Hi guys, Dr. Welsh here from Indianapolis Sport and Spine, and today I want to start off with a question. I want to ask you, how many of you out there deal with pain on a daily basis or on a pretty regular basis in your jaw and through your upper neck? Okay, and if that seems to be familiar for you, you're not alone. Up to 10% of the population deals with jaw pain, or more commonly known as temporal mandibular joint disorder, or TMJ for short. And today I just want to talk about some of that, discuss what causes TMJ disorders, and what your options are for treatment, how you can self-treat, and maybe when it's time to look into a little more aggressive treatment or looking for help outside of what you can do on your own. Okay, so to start off with, let's talk about what TMJ disorders commonly look like. A lot of times this can masquerade as headaches. You can have neck pain involved with this, but issues with your TMJ can manifest with jaw pain, clicking. It can be lack of mobility in your jaw, trouble opening and closing your mouth fully, and you can see this is more prevalent a lot of times either when you're highly stressed or if you're trying to eat, chewing things, chewy foods, chewing gum on a regular basis can also cause these issues, any kind of jaw pain, to be exacerbated or to get worse. Okay, so jaw pain in itself is a pretty complicated diagnosis because of how many different facets there are to this issue. You can have issues in the jaw itself, and these can be caused from anything from trauma, getting hit in the face, having an auto accident, or having some sort of an impact to where it throws off that jaw itself. And as we go through this, I want to stress to you, this is not a one-size-fits-all treatment or diagnosis plan. If you've been in an accident, if you've had some sort of trauma and are dealing with jaw pain, it may be time, some sort of drastic measures may be necessary. However, in most cases, that's not always the best route to start with. So, issues that can cause temporal mandibular joint problems. First and foremost is stress. Okay, a lot of people notice at the office, at work, at home, wherever you are, when you're stressed out, everyone comes in, talks about carrying their stress through this area, through their shoulders, through their neck. And at this point, I want to take a minute. I want you to do me a favor. I want you to kind of feel around the jaw, and I want you to start moving your neck around. I want you to move your jaw around. Open and close your jaw, move it around side to side. And I want you to see how many muscles you can find that are involved in just that one joint's movement. You're going to find muscles through this area, through the temporal area. You're going to find muscles through the front of your neck, through the back of your neck. Okay, so there's a lot of muscles that are involved in just that simple motion of chewing. And that should give you an idea of how complex, how complicated this can be. Okay, that kind of leads us into the next cause of TMJ issues, can be posture. If I sit at a desk and I round my shoulders and my head's down, if I spend my days like this, I'm going to tighten up all these muscles trying to pull my posture back. Okay, and as these muscles tighten, they're going to put increased stress, increased pressure on those joints. What will tend to happen is eventually that jaw will have trouble tracking. Okay, if my left side is pulling harder than my right side, my jaw is going to start shifting, and every time I chew, every time I open my mouth, that whole joint area will be shifting to one side or the other, and will cause greater discomfort and more inflammatory issues and pain through that jaw area. So the next one is mechanics. Okay, if my spine's not moving properly, if my neck is not moving properly, if the jaw is not tracking as it should, all of that is going to weigh in to how my muscles, how my everything else through my jaw and my anterior neck, or the front of my neck, is going to be able to perform their duties. Okay, and then trauma we already discussed. So I hope this helps you understand there's a lot that goes into getting you to that point of jaw pain. Okay, it's not always a simple issue of, oh, I need to wear a mouth guard, or I need to do this, or do A, B, or C. A lot of times there are several approaches that need to be utilized to try to get this, get these problems corrected. As far as treatment, okay, according to a survey that was started and still ongoing, started in 2010 at the Palmer College of Chiropractic, conservative care has a far more beneficial outcome than any kind of surgical or more aggressive treatments. Surgical care can include chiropractic, so adjustments of the TMJ of the neck, soft tissue work, and even cognitive therapy, okay, or working with some kind of therapist, a psychologist or so. And what this is showing you is that stress and mechanics plays a large role in this, because if we can address that, if we can address the poor mechanics, if we can address the stressors put on us in a daily routine, those have shown the greatest value as far as outcomes, long-term outcomes, dealing with TMJ pain. Okay. Now further down the line we can get into injections. Splints are fairly popular. Now my issue with splints, there's a time and a place for them. I think they're overused personally. You can't just take a dysfunction, a mechanical fault, and smash it back into compliance with a splint or a brace. Okay, it doesn't work for anything else in the body. We can't just smash something back into working properly. You have to look at what's getting you to that point and address that. So that's kind of my take on the splints and braces. They have their point, they have their place, but not as prevalent as they necessarily are. Okay, the final one is surgery. Okay, surgery should be a last effort, especially dealing with the jaw. However, in cases where there's disc derangement in that jaw space, so basically the area inside that joint space has been deranged to the point the joint itself is traumatized or damaged, that's the time when surgical outcomes do show the best prognosis going forward. And again, these are issues that are typically looking at more of a traumatic experience, whether it's getting hit in the face somehow or some kind of extreme pressure forced through the neck or the jaw itself. That's where you're going to be looking at a more aggressive approach. Okay, so I hope that clears up some questions for you, gives you some ideas, things to do. As far as dealing with the stress and the mechanics, things you can do on your own, I want to encourage you guys to kind of take a self-assessment. See if, how you sit at your desk. If you have a desk job, if you have a rather sedentary position in the office all day, take a minute. Every 15 to 20 minutes, get up, move around, work on pulling the shoulders back. Okay, take note of where your neck is, where your shoulders are, and the kind of stress that puts on this area. If you can do that, see if you're stressed. Do you leave work every day, 10 out of 10 on a scale of stressed out that takes you several hours to calm down? Talk to someone. Get some way of getting through that, bringing your stress levels down. That'll pay off in dividends far greater than most other applications can. So work on those things. If you chew gum, if you're a chronic chewer, that's another issue. Give up the gum, put a piece of hard candy, or give it up altogether, because all that's doing is just driving home those problems, those issues with the jaw and neck itself. So that should get you started. If those don't help, if you have questions, feel free to contact. Leave a message in the comments section. Leave questions if you have specific questions. We'd be happy to help you out or point you in the right direction. And I would encourage you to share this. Share this with your friends. Other people out there are dealing with the same issues that may not know what their treatment goals are or what their options are at this point. So share it out there. Let some people know about it. Help a friend out. Okay. And like always, we're here to help. We're here to educate and give you the more options that you can have to affect and deal with your health on a daily basis, the better long-term prognosis. So that's why we're here, guys. So again, like us, share us, get us out there, help your friends out. And for now, again, I'm Dr. Welsh with Indianapolis Sport and Spine, and we'll see you soon.